Welcome to the Healthcare and Healthy Lifestyle panel. If each organization could give a brief overview of what your organization is and does and who it serves, that would be great.
I can start. My name is Emily Gamar. I use she, her pronouns, and I am the Campus Advocacy Coordinator with SARNCO, and that's the Sexual Assault Response Network of Central Ohio. We have services on campus at OSU. That's where I work. I work on campus. All of our services are free and confidential to all students, staff, faculty, and visitors of the university. SARNCO also exists in the community. We're part of the Ohio Health Hospital System, and we have 2 helplines that are available 24/7 to anyone who has experienced sexual violence. And we also have a hospital response program that responds to all 18 area emergency departments in Franklin County, 24/7 with advocacy services should anyone present to a hospital after they've experienced a sexual assault.
Hi everyone, my name is Leah Hones. I am a development representative from LSAC St. Jude Children's Research Hospital, which is the fundraising and awareness organization for St. Jude. Pretty much what St. Jude is, it's a hospital based in Memphis, Tennessee, but we treat patients from all across the United States and the globe to help hopefully cure their childhood cancer. Some of the great things about St. Jude is that no family, when they come to St. Jude, receives a bill for treatment, travel, housing, or food, because we really truly believe that every family should just worry about their child and not have to worry about those crazy healthcare bills. But we also freely share our research and our knowledge to exchange ideas openly and to make more collaboration between doctors and researchers worldwide and providing more life-saving treatments for children everywhere. So excited to be with you all today.
Hello, can you guys hear me? Sorry. Good. Thank you all for coming, and thank you for the host for inviting us in. My name is Dr. Hanif Dawali. I'm with Havioko USA. We're based here right in Columbus, Ohio. We're actually an international organization that has offices throughout Africa and North America. And we've been around since 2000. So I think we've been around since 92 internationally, and we've been around in Ohio since 2012. Our focus really is healthcare advocacy and providing access for healthcare needs for the new American communities, the new immigrant communities, and ensuring those communities that are vibrant, that are contributing great work and deeds to our community do have access to those precious resources. Nice meeting you all, and look forward to learning more about the other attendees. Thank you.
Great, thank you guys for sharing about your organization. Now, the first question I'm going to ask you is, the American healthcare system is very complicated, for lack of a better word. How do you help or advocate for those who may not have access to healthcare?
Maybe I can go first there, Mara. For us, I think the key challenge, as you probably can appreciate, is ensuring that, especially if you are new to a community like Columbus, that our members and the communities we serve understand how to navigate the healthcare. I think it's one thing dealing with the complexity of the American healthcare system. It's a totally different thing if you have barriers such as cultural nuances, language, and so on and so forth. So for us, we look at it, take a step back and ask the question, well, if English was a second language to you, or, it wasn't a language to you as of yet, how would you go about finding what you need? And what we find is often the simplest things we native speakers take for granted is really difficult for the immigrant communities. So part of our focus is to ensure that immigrant and new American communities do have a literature that is attuned to the language they speak. And at the same time, ensuring that for those that do require emergency medical needs or otherwise do have translators with them, as well as interpreters that they can have access to. So that's one way of trying to demystify the healthcare system from the perspective of the immigrant and new American communities.
At St. Jude, our unique operating model is really cool, in my opinion. Obviously, I'm a little biased because I work for the organization, but when a patient comes to St. Jude, they don't receive a bill for absolutely anything, as I mentioned earlier. So even if the family does or does not have access to healthcare, we won't deny them at the doors of St. Jude for them not having to pay for absolutely anything, whether it's a Band-Aid, a toothbrush and toothpaste if they have hurriedly come from their hometown and flown or driven to St. Jude, which is located in Memphis. So we try to just make every family that is going through treatment, just make them feel like they just need to focus on their child, and having the doctors just do their thing and making sure that the child hopefully gets cured. But it's where my place comes in, where I make sure where the funds get to St. Jude. So primarily what I do for LSAC St. Jude is the fundraising and awareness portion of it. So having fundraising events and connecting with donors to ensure that no family receives a bill. And that's incredible that we can create those fundraising dollars to support the mission of St. Jude. So hopefully that kind of answers that question, but I do think it's really awesome that I've just heard from so many St. Jude patient moms and dads, and even from patients themselves, just how incredible it is that St. Jude has given them hope and not having to worry about paying for absolutely anything, which is incredible.
And I can focus on our survivors who are in the hospital systems. So whether they are going there for emergency medical care or they are going there for a forensic exam, our advocates are really in place to help make that whole process easier and to advocate for the patient in that system. The way we describe it is there are lots of people doing very important jobs when a survivor gets to a hospital. You have the nurses, social workers, doctors. You also have law enforcement that's automatically called to an emergency department in the state of Ohio when a survivor presents. So you have lots of people with very important things they need to do. Our advocates are just there for the patient. They are just there to check in with them, to see what they need to understand, see what resources they need, and to help them navigate during their hospital stay. And so that's really how we increase access in that hospital setting, is to make sure that people understand they're able to make informed choices and really to support them with whatever they decide.
All right, to kind of piggyback off that question, are there any resources in the area your organization points others towards when they do not have access to healthcare? And if so, are those resources confidential?
It's a great question. We are a great proponents of collaboration. We work with a number of organizations, both at the state, at the at the state, at the county, and at the city level. We also work with healthcare systems such as Ohio Health. And our focus really is we want to be a conduit for information rather than, dare I say, siloing information. And that's really critical, and it's part of our ethos. So our focus is to ensure that if there are specific resources that we as an organization don't have access to, we like to lean on our partners across the spectrum and to ensure that those information can get to our communities as efficiently as possible. So nothing is secret in terms of the resources we have. We actually thrive on the collaboration. I think siloing is detrimental to the work we do.
I'll go next. St. Jude is not only a hospital, but it's also a research institution. So we use the studies of our St. Jude patients and we want to do research on them, there are like 2-3 stipulations to be a St. Jude patient. And one of them is that the diagnosis of this child has to be a current research study that we're working on, because we do want to try to figure out what is wrong with this patient and what we can do as an organization to help cure it. So we have the student or the St. Jude patients go into studies and we do research on them, but we freely share our research so other doctors and researchers across the country and across the globe can access it free of charge as well through our St. Jude cloud. So our resources are not confidential, and we also freely share our financial statements as well, since we are a not-for-profit organization.
And for me at Sarnco, we are a technically freestanding rape crisis center, but it's great because we are part of the Ohio Health Hospital system. So we do have access to a broader system that can support survivors when they present. There have been a lot of great instances, whether somebody is a sexual assault survivor, whether they are experiencing domestic violence or human trafficking, where the hospital has really stepped up and done the best they can for that patient so that they can increase access to healthcare. And they also have a lot of really community collaborative initiatives within Ohio Health and within Sarnco. We work with Ohio State's medical system, we work with Mount Carmel's medical system, and we also work quite a bit with Equitas Health, which in my experience as an advocate has done a really great job locally of supporting LGBTQIA+ patients and having really affirming services for them.
All right, thank you for those answers. I'm gonna jump down to talking about how COVID-19 has impacted your organizations, but specifically how has it impacted your ability to have volunteers, and what was it like prior to COVID-19 for the volunteer programs you have?
Great question there again. COVID-19, and this goes for not just our organization, for other organizations, has truly impacted how we do business and how we really provide our services to the communities. In the past, from a volunteer perspective, we had both a regimented program as well as an ad hoc program where students, whether they are in college or in high school, would typically reach out to us, typically during the summer months. That naturally has changed this year. And one of the ways we've tried to adapt to the new environment is really how do we leverage, just like what we're doing right now with some of the online resources, to ensure that our volunteer base is still active and is still engaged. Right now it's still a work in progress because there's only so much you can do online in terms of some of the work that our volunteers can do. But at the same time, in terms of engaging with the communities, our volunteers are strictly observing the requirements for social distancing and having access to PPE resources that we provide.
At St. Jude, volunteers are a huge part of our daily operating system at the hospital and in our local field offices. I think I forgot to mention earlier, but I'm in our local Columbus, Ohio field office, but our field office covers the full state of Ohio with fundraising events. So with hashtag COVID-19, it has greatly impacted the events and fundraising space. As you all, as collegiate students may know, a lot of things have changed. So a lot of our volunteers have now turned into different sorts of advocates for St. Jude. We do still work with volunteers. They used to obviously come to our events and help with the various tasks, but now we are still always wanting volunteers and connecting with them, but just connecting with them on a different basis and supporting us in a virtual way.
At Sarnco, we've been really fortunate that COVID has not impacted any of our service lines adversely. We have been able to shift all service lines to virtual, and thankfully our 2 helplines, one we have that's statewide and one that's local, were already operating virtually, so there was no service interruption there. Our hospital response system that I mentioned earlier was able to shift virtual so that our advocates at first were able to call in to emergency department rooms to speak with survivors. And since then, our hospital coordinator has done really great work and has been able to get iPads into hospitals so that they can be wheeled into rooms and they can be face-to-face, similar to how they would be with an electronic interpreter. And so that's been a really great thing that we've been able to do. I'll echo what others have said. Volunteers are essential for SARNCO to operate. They always have been. We've always had a good base of 100 to 200 volunteers locally, and we are still, I think, actively recruiting all throughout the year for volunteers.
All right, so now I'm gonna go ahead and go to the Q&A questions. One question is asking, there's been a shift over the past couple of years towards a more value-based healthcare system where incentives are based on health indicators or benchmarks. Has this current pandemic accelerated that transition because we are now more informed of potential risk factors for the coronavirus and various other diseases? And how have you shifted strategies throughout this pandemic to care for a greater number of people?
Wow, that's a great question. I think healthcare has been moving in that direction in terms of a value-based healthcare service, which makes sense. The old system wasn't going to be sustainable in the long haul, especially when it comes to from a funding perspective. If anything, COVID-19, what it's done is accelerated some of those trends, specifically in ensuring that healthcare is more accessible to a wider community. I think one of the key findings that as a community we were able to identify with COVID-19 is healthcare impacts our community based upon their existing socioeconomic standing. So those who are on the higher echelon typically have been fortunate in terms of avoiding some of the worst situations. Conversely, those who are on the lower socioeconomic rung have been terribly impacted. You know, if you're we call it a mother or a father who are working shifts at fast food restaurants, etc., you cannot afford to take time off, nor can you work from home, so to speak. And those are the ones that are likely to have less healthcare access and are more prone to incidence of COVID as well as any other disorders. So I think what COVID-19, despite its terrible impact on the nation, as well as our community here in Columbus, has shown is for us community to thrive, as a community to thrive, we need to look at the most vulnerable of our members as a community in general. And that requires ensuring that more healthcare services are going to areas that need it the most, and making sure that money isn't a barrier to that. Just to dovetail from what Leah said from St. Jude, I think it behooves healthcare providers, all stakeholders, to be able to ensure that money isn't, we call it, the principal deciding factor who has access to healthcare and who doesn't.
Trying to find the question because I want to make sure I answer it correctly. But as a fundraiser, I do get some information from the St. Jude side about what is going on with our COVID-19 procedures at St. Jude. But I can tell you that the pandemic has definitely accelerated the way that we work on the fundraising side. We have definitely pivoted, which is a word that I feel like is a permanent word in everyone's vocabulary these days. But we've pivoted to ensure that our fundraising efforts remain up to date and remain current with some of the objectives that we want to see as an organization, like innovation. Innovation has been a huge thing on the LSAC side of St. Jude, and just ensuring that we are being creative and different than some of our sibling charities that we see across the globe. But in regards to the COVID-19 pandemic with the healthcare system, it definitely has made our researchers become more aware and wanting to figure out what the COVID-19 pandemic is doing on children with chronic illnesses and diseases. So there's definitely research going on, but right now there's no official like articles or information that St. Jude has at least provided me.
And I will say, since I'm not strictly in healthcare, this question isn't necessarily so much for me, but I can say one of the things that's changed in part due to COVID is we know that domestic violence is its own public health crisis, and it has been exacerbated by COVID. People are having to stay at home more, or they are in positions where they are essential workers and maybe in service areas where they are more likely to experience sexual harassment or sexual assault. And so one of the things that we've done at SARNCO is historically we've only responded to sexual violence, but we have now started responding to all hospital reports of domestic violence virtually. And we've been trying to build our capacity to have more of a presence in hospitals for survivors who are presenting with any kind of domestic violence concern.
All right, great. So I think this will be our last question. We touched on it a little bit, but just to reiterate it, I want to ask each organization if they know, like off the top of their head or stuff currently going on, what virtual volunteer opportunities do you have available for students?
It's a great question. We actually are, we launched a couple of projects we definitely need assistance on. We are still revamping the specific roles we want volunteers to be, to take part on. The easiest way is I'm going to drop my email, and for those that are interested in volunteering for us, please reach out to me. The short answer, yes, we need volunteers. We need as much as possible to be able to get, for us to be able to engage with the wider community. So yes, please reach out to me. I will give my email tomorrow, and please definitely reach out to us. I definitely believe we need your help. Thank you.
I'll go next. Working with collegiate students, you all have such great potential with doing so much for the kids and families at St. Jude. One of them is fundraising. There are various different fundraising opportunities that I can provide to you. I'll also give the Pay It Forward panel my email address and phone number if you want to fundraise for St. Jude, but I can also provide, there are opportunities for you to gather items and ship down to Memphis for the St. Jude patients. Obviously, some of those items have changed a little bit since COVID-19, but I can definitely provide a list of some needing materials and toys and such that St. Jude patients need, and I could provide that later.
Yeah, so all of our service lines could use volunteers. We have 2 helplines and a hospital response program. We also are building capacity to have speakers out in the community speak on sexual violence and be trained to do prevention work, and some social media opportunities as well to increase that outreach to communities. And so I can put in the chat, if that would be helpful, our link to our volunteer page, so you can download the application and learn more. Our next 40-hour training for all of our volunteers is in October, and we're going to be interviewing soon. So this is a really great time to look into SARNCO if you're interested. I will say we have a lot of OSU students. There are a lot of colleges that actually require you to have some volunteer experience. I know genetic counseling, psychology, social work, College of Medicine even recommends folks to do some individual work with folks before they get started in their career. So if any of that sounds of interest to you, please check us out.
All right, great. Thank you so much to our panelists for coming today and sharing a little information about their organizations. And thank you to the hosts, and thank you to everyone who attended today. Our next panel will start shortly, and it'll be the last one. Thank you.